One of the strategies that I have found to be so effective and impactful in our hospital is that we have a dedicated nurse who also does work in social work. She's dedicated to our intensive care unit. I work in the medical ICU, and so we have a nurse navigator is what the concept is called. And her job is to help the families, period, and stop. Like, that's what she does. She's there on rounds with us every day. She takes notes on all of the key labs. She pays attention to every patient's medical course. Because she's a nurse, she has that training and that expertise to follow what's going on medically with the patient. And then she meets with all of the families within arrival to the ICU. She follows up with them almost daily, every family in the ICU. And she helps the physicians communicate with the family members, and she helps the family members make sure that when the doctors finally come in, that the communication is more effective, that the family members are ready to ask their questions, that she's sort of done some of the pre-work in order to make sure that that time that between physician and patients and families is most effective. She organizes all of our family meetings and usually facilitates them, meaning she serves as sort of the MC and then hands it over to us as the physicians. And that can often be very helpful because it creates a team approach where it's not the doctors coming in there and, you know, being at the head of the table and everyone else sitting and listening. It's everyone takes their turn. She sticks to a structure in a family meeting so that we have families, we all introduce ourselves, we say we're going to give a medical update, and then we're going to answer questions, and then we're going to do XYZ agenda items of the day. That system has been really, really helpful because our patient navigator has been able to spend time that we as physicians may not have up front before we come into the room and do some of that ground laying before we get there for patients and families that maybe need some preparation for some of the topics that we're going to discuss. She's keyed into that and can help prime the families and get them ready for our conversations. And so I've found that model to be extremely effective. Anyone that works in a unit with a navigator and has worked in a unit without a navigator can see and feel the difference. And so I think in a perfect world, all hospitals would have some kind of a navigator in all their units all the time.